Hi, everyone. Now that you have learned some fundamental principles that drove the development of our CARESTREAM program, specifically preventing the three F's of falls, frailty, and functional decline, as well as identifying important determinants of health to enhance health equity and access to resources, this week we are taking a look at a branch of science called health system science, which describes how healthcare is delivered to and received by patients and populations. This serves as a pivot point in the course. Most of you will eventually enter into professional clinical curriculums to learn how to deliver specific types of healthcare. But for the remainder of this course, we want to introduce you to health system science principles, which describe how healthcare is delivered. We're introducing this to you for two reasons. First, you've been involved in your clinical learning experiences for many weeks now, seeing both the amazing capability and surprising deficiencies in the healthcare system. We can all agree that each of the clinical providers, support staff, and administrators all have the patient's best interests in mind, and yet gaps in care, lapses in judgment, and a lack of continuity are common problems in our system. How can we understand how a system that is so well funded and supported by cutting edge science and evidence continues to have these types of common problems? Enter this week's module. Secondly, many of you have commented on ways in which you believe the system could be improved based on your experience in your care setting. This is important and encouraged that you begin to ask questions of why are we doing things this way and how could we make an improvement? Some of this week's videos will introduce the basics of health system science, including a high-level introduction to methods of healthcare improvement. This is a really large and diverse topic that we're only going to scratch the surface of, but we're eager to give each of you a greater awareness of the presence of this field of science. Now, take special note of your assignment for this week, which requires you to select from one of two common health system science tools. The first option requires you to develop a basic process map of one aspect of your clinical learning experience. So this is likely a task that you've been routinely involved in your clinical setting or that you've observed. Consider who else is involved in the task, the order of the task, and where decision points are to proceed or change course. The videos provide examples and more explanation. Another option, instead of a process map, is to develop a human factors intervention matrix for a particular problem that you've noticed during your clinical learning experience. This problem is likely something that you've seen many times during your experiential learning, and this tool offers you the ability to strategize ways in which this problem could potentially be solved. Be sure to consider who is impacted by this problem, as well as their perspectives when suggesting potential solutions. So it's not expected that this is a perfect process map or human factors interventions matrix. Give it your best shot. This is a great opportunity to practice these important tools that can be critical on certain healthcare improvement projects. We look forward to hearing your feedback and seeing how you can map processes and suggest potential solutions.